Newsday medical reporter Jocelyn Memento spoke with doctors and patients about United Healthcare Medical Advantage today. She joins us live in the New Haven newsroom with what you need to know. Jocelyn.
Keith and Ann, there's a lot of uncertainty about what to do next. Termination letters were sent out last week to hundreds of doctors on the list of providers for the United Healthcare Medicare Alternative Plan. As more people are made aware of what's going on, the level of anxiety ramps up with it.
If you walk into the office of ophthalmologist Dr. James Pink, you'll see displayed prominently at the reception desk this alert that he, along with hundreds of other doctors, are no longer on the list of providers on the United Healthcare Medicare Advantage Plan as of February 1st of next year.
We re-signed our contract with them in August, and there were no issues whatsoever.
He filed an appeal, but a decision will come after the Medicare open enrollment ends.
No one will talk to us at United Health.
So he's worried about patient care.
And I'm concerned particularly with patients with chronic disease that have very little ability to travel far away, and particularly in the case of eye disease.
Sally Smith drives 45 minutes to see Dr. Pink.
I really haven't decided what I'm going to do.
She has been a patient here for more than 10 years.
I called them and asked if he was on the list, and they said, oh yes, he's on the list. I said, well, would you check for 2014? And she said, oh yes, he's on the list for 2014. I said, well, what about on February 1st? And she said, well, they didn't know.
This practice of primary care physicians is trying to decide what to do. Internist Dr. Richard Sakarak explains.
But we haven't been told why we were terminated. So we need a reason to appeal first, and that's what we're trying to find out.
The focus right now?
We're trying to identify which patients have United Healthcare, and then we're trying to call them and trying to direct them.
Dr. Sakarak's patients are visibly upset.
The thing is, they don't let you know anything.
I'm not going to go to another doctor.
But if you stay with him, it'll cost you more.
I'm going to stay with him no matter what.
I'm looking into other insurances right now, but it's going to take me time. I still have until December 7th to decide on what I'm going to do. But no, I don't want to lose him.
Seniors have the option of staying with the United Healthcare Medicare Advantage Plan or looking at other insurance carriers who also offer it. But as you just heard, many do not want to leave their longtime physicians. What's key here is this: finding out if your doctor has received a termination letter from United Healthcare. And tomorrow, United Healthcare is running an ad in newspapers across the state. In it, CEO Jack Larson says, and I'm quoting now, "We are working to collaborate with a more focused network of physicians to help us provide higher quality and more affordable health care coverage to meet the needs of our members and help them get more their health plan benefits." We'll keep you posted on any new developments.